Once again, welcome to Katase Physical Therapy Services YouTube channel. Today we are going to talk about the experiences and journeys of patients who have been having back pain while seeking physiotherapy services. Please watch, like, subscribe and share. Thank you. Welcome. As a physiotherapist, I've seen many people who have had back pain. I have different experiences of those who have been having back pain, their journeys towards treatment, and how they have managed to see a physiotherapist and seek services from a healthcare provider. If you're experiencing back pain, possibly this might be due to various factors. Either you've had an injury, either you've strained your back while you're at the gym, either because of occupation, you've been sitting for a very long time and you're wondering what has really provoked your back for you to have pain. So before you seek any treatment, you go to a doctor to seek for intervention and to try and get help to relieve your pain. So when you have back pain, you probably have gone to see a doctor. Their consultation will be done, an assessment will be done, and various recommendations will be given to you. Number one, a doctor can either decide to give you medications to relieve your pain that you take for a period of time, or they will recommend you to do an investigation, which might be an X-ray, an MRI, so that we try to find out what really is going on with your back. My experience as a physiotherapist, at that point when you've done consultation to a doctor, you might be wondering at what point are you going to see a physiotherapist? Are you going to wait for a doctor to refer you to a physiotherapist, or you are going to seek services to a physiotherapist after you've been managed through the doctor either by medications before you seek physiotherapy services? In my experience in terms of managing back pain, you can either see a physiotherapist after being referred by the doctor to come and seek physiotherapy services, or you can even just visit a physiotherapist for the services so that you can relieve your pain. Now, there is a situation where many people get lost when they are seeking physiotherapy services. When they go to seek doctor's consultation for management of back pain, they end up being recommended to utilize one strategy of management that can be either to just, use medications for 3 months and then after that come for a review. And in that situation, when they do that, when they come back, they're still having back pain, and then they'll be referred for physiotherapy later when the condition is worse. For me, in my experience, I recommend that when you have back pain, when you've sought consultation from a doctor and they have given you recommendation of either to do an X-ray, take an MRI, or take medication for a period of time, it will be best if you also visit a physiotherapist so that they can manage your condition. There are various types of back pain that need physiotherapy intervention. Especially in my experience is that there is back pain as a result of muscle tension and tightness that limits you to perform your activities of daily living. For example, when you want to move out of the car, you feel your hip is tight, your back is tight, you want to stand up from sitting, you can't manage because there is pain along your tailbone region. You've been told that you have a disc bulge or pain as a result of a disc prolapse or bulge, and it's leading into pain and numbness along your leg, either up to the knee or past the knee. You might be experiencing numbness on your back, on your hip, along down your leg. So all these causes, when you visit a doctor will be focusing more on relieving your pain, but at the same time it should not only end at that point. You should visit a physiotherapist so that they will be able to assess the physical approach of your body in terms of the tension, in terms of how your body has changed because of pain, so that as much as you are solving the pain pattern and the pain that is resulting from tissue injury and damage or irritation, a physiotherapy can help you to manage pain in various ways. In my practice, I've noted one thing. Many people might feel comfortable that back pain is only for adults. Back pain affects all age. In terms of being an adult, back pain affects the adults. Back pain affects the teenagers, and also it affects other ages in the lifespan. When you have back pain as an adult, maybe you might have felt that when you seek treatment and the pain does not resolve, or your back pain still continues to relapse, you might feel that it is normal. It is not normal for you as much as you are an adult or you are in the old age group, that because you have back pain and it's not relieving, or you are not getting better out of it, that you should stay with it after the doctor's consultation and even after you've done physiotherapy, because all these things can be done differently. It can be done in a manner that you can know that it is being done correctly. For instance, how would you know that the right thing is being done when you have back pain? When you visit any health practitioner, be it a doctor, be it a physiotherapist, at the first time of visit, number one, an assessment will be done. You will be done an assessment. The healthcare practitioner will tell you what is going on with your back. Is it because of a disc? Is it because of muscle tension? Why is this one happening? And all other things that might be involved with your back. At what point should you be concerned when you have back pain and you want to know if the right thing is being done? Either you've seen a physiotherapist or a doctor. Number one, assessment. Is the assessment being done well? Is any health practitioner taking time to do an assessment? The assessment is not basically about asking questions and noting down your complaints and giving medications and recommendations or advice alone. Assessment includes a physical approach, identifying what you can't do, the functional things that you cannot perform because of your back pain. For instance, in my experience, I am concerned if you are seeking physiotherapy services and once you step into any treatment intervention and there is no proper assessment that is done, no one is going to check on your areas that you having pain, especially if it's the back and there is pain radiating down the leg. There's no test that has been done. When I talk about tests, I'm talking about other activity or other tests that have been used other than doing an X-ray and MRI. There are tests that physiotherapists used to do and assess and to know at what extent and which structures have been affected. You need to be concerned if your symptoms are not relieving. Your symptoms keep on relapsing, for instance, without any better recommendation. Maybe you are relying more on medication. That one should be a biggest concern for you. You shouldn't be taking medication in a spaced period of time. In my experience, I've had many telling me that they normally get their medications in the morning, in the midday, and also at the evening. It means that your back pain is not well addressed, so you are relying more on medication. That one should be a sign that the right thing is not being done as it's supposed to be done. When you depend only on one line of management or treatment, for instance, if you are visiting a physiotherapist and they are only utilizing one mode of treatment, there is no change or think through about your management in terms of the intervention. Are they utilizing exercises alone? Are they only repeating one thing that is being used in that period of time, let's say for 1 week or 3 months? Are they only using that one mode of treatment alone? As a physiotherapist, in my experience, there are different models and patterns when you are treating a patient. If someone has back pain, you can first of all utilize the approach of releasing tension. After that, you will utilize the approach of enhancing mobility. After that, maybe you might engage in exercises so that you strengthen the weakest muscles, and also you do stretches so that you can be able to relieve tension on the structures that might be linked into your complaint. With that, it means that you are getting the right approach. But if you are only utilizing one mode of approach or a routine planned or scheduled treatment approach, then it means maybe you are not getting the right approach. you might have gotten this advice at some point. This is because maybe your complaint because of pain has not resolved. In my experience, I do prefer and advise that surgery becomes the last option in terms of management. And we should not emphasize it as just being the last option. It should be the last option if necessary. So you only need conservative management. When we talk about conservative management, we are just talking about physiotherapy in terms of addressing this complaint or this pain through physical therapy approach, and maybe you can utilize medication so that to counteract the use of physiotherapy to get you better. Surgery is only needed or an option at the extreme levels where you hear your doctor or your consultant telling you that there is compression at the level of your back, either at the spinal cord, and it is giving you difficulty or continuous symptoms of numbness and other issues out of the compression from your spine. So physiotherapy will always be an option before you reach to surgery intervention. So something to note is that if you get advice to just do surgery before you have done physical therapy, then you need to be concerned. My experience with back pain. When you have back pain, there are other things that might be associated with back pain. It might not only be pain on the back and numbness down the leg. It might be back pain and knee pain. You might have back pain at the same time with hip pain. You might have back pain with anterior thigh pain. You might have back pain and even ankle pain. Still, when you have back pain, it can be associated with also neck pain by virtue of muscles that attach on the back and also attaching the same time on the neck. So when you have back pain still, you will have hip pain, and when you have hip pain, it might translate to shoulder pain. When you have shoulder pain, it can even result to neck pain again. There is a whole chain of how your back is associated with other areas on your body. Thank you so much for watching. I hope this information goes an extra mile in helping you as you are seeking physiotherapy services, especially in managing back pain. Please don't forget to subscribe, like, and share with friends. Thank you.